Have you been told that the reason that you have a pain in your butt in the piriformis area is because your glutes are weak? If so, this is something that I hear every single day. And in this video, I want to break it down and help you maybe reframe that belief system. Because as we know, your beliefs will inform your actions, which will inform your results. And if you have a belief that weakness in your glutes is causing your glutes to hurt, then you'll take actions consistent with that. If weakness is the cause, well, then I must strengthen Charlie to get out of pain if that's the desired result. Hi everyone, my name is Dr. Charlie Johnson, physical therapist, and this is one of the most common belief systems that I come across, and it leads to people doing lots of bridges, lots of leg raises, lots of clamshells, and just countless glute stability videos thinking that will solve their problem. And so in this video, I'm going to share with you 6 signs which suggest glute weakness is not the cause of your symptoms, which means you shouldn't go down that path. I'm also going to share with you 6 signs which suggest that glute weakness may be the cause of your symptoms, and again, this gives you an idea as to whether or not you should be strengthening or not. Check it out. And if you'd like to determine the most likely source of your back, butt, or sciatica pain for free, go ahead, click the link above to download my Better Than an MRI DIY diagnostic guide, or check the link in the description. All right, so let's start with the signs that glute weakness is not the likely cause of your piriformis syndrome pain, and therefore strengthening will be a waste of time. So sign number 1, if you have pain while you're sitting in your butt, then the chance that glute weakness is the cause of your pain is essentially zilch.
And why?
Nada.
Why is that?
Why is that?
Why?
Wonderful question. How much strength is required to sit?
Of my butt?
Of your butt.
When I'm sitting on my butt?
Correct. How
Probably-
hard do you think your butt is working?
Probably not very much.
Probably not very much.
Yeah.
And so if glute weakness is the cause of your pain in the butt when you're sitting,
Mhm.
but your glutes don't require any strength
Mm.
to sit, then why would strength help resolve it?
Yeah, it probably doesn't make sense.
I'm strengthening my glutes because my glutes don't need any strength when I sit,
Yeah, if the problem's when I'm sitting.
if the problem is when I'm sitting.
Yeah.
And so why strengthen your glutes if you have pain in a scenario where glute strength is not required?
Yeah, that makes sense. Yeah.
All right, we good with that?
Yeah.
Okay.
Yeah.
Along the same lines, and we could just create many of these scenarios, but another obvious one would be if you have a pain in your butt while you're sleeping or while you're lying down,
Mhm.
then this is a telltale sign that glute weakness is not the cause of your pain.
Right.
Are you sure?
Well, yeah, because you're not really like using your glute muscles when you're laying down.
Correct.
Yeah.
When you're sleeping, when your eyes are closed, or you're just chilling on the couch,
Right.
it requires almost no strength, essentially zero muscular activation of your glutes to perform that task.
Right.
And so saying the reason I can't perform that task, sit or lying down, is because I'm weak, makes no sense.
Right. That makes sense.
There's no horsepower required of your glutes when you're doing those things.
Yeah.
The absence of activity, sitting and lying down are a position. They are the absence of motion, the absence of activation or strength needed of the glutes. And so why would you need to strengthen them?
Yeah.
And why would weakness be the thing
Yeah.
that's causing it?
Probably wouldn't fix the problem.
Probably wouldn't fix the problem.
No.
All right, next one. All right, the third sign. If your pain came on suddenly, then glute weakness is not the cause of your pain.
How come?
What do you know about how quickly the body becomes weak or becomes strong? Does it happen immediately, suddenly, or does it take time to become weak and time to become strong?
Yeah. Usually over time.
Over time.
Yeah.
And so if you're pain-free one moment, and let's just say you twist a certain way and then you feel pain in your butt,
Mm-hmm.
suddenly, how much
Weakness didn't happen right
weakness
away.
didn't happen right away.
That
Now,
makes sense.
weakness could happen right away if you damaged a nerve or something like
Okay.
that. But generally, you're going to have other symptoms associated with it. So if you cut a nerve, one of your gluteal nerves or one of the spinal nerves or something like that, then yes, that could cause like paralysis or loss of function of the muscles in your glutes. But those wires also generally supply many other areas of the leg as well. So if you had a sudden onset of symptoms, chances are very high that if you agree that strength changes take time,
Yeah.
unless you had some massive neurological fallout
Right.
when you were
Right,
twisting
right.
a certain way,
Yeah.
if you had X amount of strength in moment A,
Mm-hmm.
and then just moments later, scenario moment B, you had the same X amount of strength,
Right.
but you were pain-free here and you were now in pain there,
Yeah.
it tells you that glute weakness cannot be the cause because it does not happen suddenly. Again, unless there's some massive neurological insult.
Yeah, that makes sense.
Cool?
Yep.
All right, so the fourth sign, if strengthening hurts, then the chance that doing something that hurts over and over and over again, and that it's going to make you not hurt, is not very high.
Well, what about like no pain, no gain? Like if you're trying to build muscle, you've got to make it hurt. Like it's supposed to hurt, and then it rebuilds, right? Like
I'm glad you asked. All right. What is your goal if you have a pain in the butt? If you give me a call and you have a pain in the butt, why are you calling me?
To get rid of my pain.
To get rid of your pain.
Yeah.
Or is it because you want stronger glutes?
Well, stronger glutes makes my pain go away.
Correct. But at the end of the day, if I said you've got to pick.
Yeah.
You can have the most butamus, glutamus,
Yeah.
or you can be pain-free.
Right.
Which would you prefer?
Pain-free.
Okay. So now you're linking the two.
Mm.
But these are two different conversations. Oh, well, Charlie, strengthening can't hurt. And oh, I have this belief that if I strengthen my glutes, all a belief, by the way, then my pain will go away. We're talking about how that maybe doesn't make sense. But what's interesting is that when people are in pain, the ability to assess the strength in the glutes completely goes out the window.
Mm.
And so if you're watching this right now and you're just like, hey, I feel like my glutes are weak. Well, have you ever had like a flu shot in your shoulder?
Oh, yeah. Mm-hmm.
Or some type of shot?
Yeah.
And then how strong does your arm feel?
Oh, it feels like it
feels like jelly.
Yeah, it doesn't feel good.
Right. You don't really want to use it. And
It
so you
feels
walk
weak.
around, it feels weak.
Yeah, it feels weak. Yeah.
It's one thing to think and feel something, but weakness is an objective finding. It's not like, hey, I feel weak.
Mm.
It is when you test my strength, it is objectively weaker. Now, the problem is when people are in pain is that things feel weak because pain is a great protector and it causes you to create feelings and sensations in your body to protect you.
Mm.
Feelings of tightness, feelings of weakness, feelings of guarding.
Yeah.
The issue is that a PT might lay you on your side and test how strong your leg is. They might ask you to resist certain things or have you push into things, and then they'll get a gauge as to how strong you may feel. You might walk up the stairs and say, oh, it feels like my right leg or my left leg, whichever side the pain is on, feels weaker. Well, of course, because it hurts. Just like when you get a shot into your shoulder, it hurts, it's sore. And so your body goes into protective mode and maybe doesn't want to use it as much.
Mm-hmm.
And so it just makes sense that if something hurts, the ability for you to assess the strength is not going to be accurate. And this is the challenge, because you can say, oh, well, they tested my strength and it seemed like it was weaker.
Right.
Well, of course, if I make you feel a lot of pain in a certain area, the chance you're going to want to contract that area to a high extent or to a high degree or to its maximal potential is not very high. And so you'll get a false positive. It's weak, when really it's just painful. And so a lot of people believe that when they strengthen their glutes, their pain will go away.
Mm.
But when their pain goes away is when their glutes all of a sudden become strong again.
Oh, interesting. And so it's not supposed to like hurt before it gets better. Like
Correct. I went a little off topic there. All right?
Yeah.
But yeah, I mean, if I do things that hurt over and over and over again, repetitiously, 3 sets of 10 reps is what everybody says for these glute strengthening exercises, right? The more I do things that hurt, the better I'll feel. What are your thoughts on that?
Probably the more I do that hurts, the more it's going to hurt.
Right, yucky in, yucky out.
Yeah.
Your output is a direct result of the input.
Right.
And so if you are making a smoothie and you have yucky ingredients, and I say, hey, you want the best tasting smoothie on earth, I'm going to give you the yummiest ingredients or I'm going to give you the yuckiest ingredients. At what point would you tell me, hey, the more moldy strawberries you put in there, the better it's going to
I was
taste?
just thinking of moldy strawberries, and I was like, that's not a good idea.
Probably because we got some in our fridge.
Yeah.
All right? And so you could try it, and if you're watching this right now and you're like, well, they said no pain, no gain. Where's the logic in that? The logic is that it exists only in the story you tell yourself about why you hurt. And or the story someone else has planted into your brain. You have weak glutes. And so, Charlie, I'm going to ignore everything I'm feeling. I know it hurts. I know it hurts. I know it hurts. I know it hurts. I'm going to ignore everything that I'm experiencing because I believe so strongly that my glutes are weak and this person told me this and this is what I feel. Emotion, making decisions off the emotion versus the data of like, it's actually objectively weak.
Yeah. So make it stronger, but it's really hurting as you're doing it.
It's really hurting. It's really hurting. Belief system, I don't care. Beliefs inform actions. Keep strengthening, keep strengthening. It'll get better, it'll get better, it'll get better. How long do you want to keep going down that path? Where do we start with that question?
Yeah, well, like
if strengthening hurts,
right,
then
it's
the
probably
chance
a
that it's going to be
sign.
the solution and that glute weakness is really your problem, probably not very high.
Right.
Or even if it were your problem and you actually were weak and that's the reason that you did hurt, good luck trying to achieve pain relief by doing something over and over again that doesn't feel good, that feels unsafe. All right, so the 5th sign, maybe it's the 6th sign. I lost track in that conversation, it doesn't matter, is that if glute strengthening, and we'll lump strengthening into just a series of, say, classic exercises. There's many ways you can strengthen your glute, but you all have seen this before if you have this belief. You do the bridge. Can you do the bridge for me? If glute strengthening immediately reduces your pain, then glute weakness is not the cause of your symptoms. Does that make sense?
We'll say it again.
If,
sorry.
Final sign, all right? Hello.
Sorry.
That glute weakness is not the cause of your pain is if glute strengthening, doing, say, a bridge, a glute strengthening exercise or exercises, immediately reduce your pain. I'll answer for her.
Good.
The reason that this proves that glute weakness is not the cause of your pain, because you might say, well, I'm doing a glute strengthening exercise and it reduced my pain. That means I need to strengthen my glutes.
Yeah, I would have thought that.
How much stronger in 30 seconds of doing a bridge did your glutes get?
That's a good point.
They didn't.
Oh, yeah.
You cannot achieve strength changes in 30 seconds.
Oh, yeah.
Got it?
I get it now,
And
yeah.
remember, there was this video I shot a while, and I'll link it here, maybe on the end screen or something like that. It says, stop stretching, start strengthening. And I started to get people to reaching out to me all over the world who were like, hey, I did a clamshell or I did a bridge and 15 years of pain gone in 30 seconds. And it was like, what? That's weird. And they're like, thank you. Well, this whole time I should have been strengthening. And I'm like, no, wrong message. Because I'm like, there is no way that you just strengthen your glutes in 30 seconds, a minute, a day, 2 days.
Right.
So if you're seeing immediate changes from glute strengthening exercises, then it is actually counter evidence that weakness is the cause of your pain.
Yeah.
Because there is no way you are changing the level of force output, or strength we'll call it, in seconds,
that short
days.
Time. Yeah, that makes sense.
6 weeks?
Right.
Maybe. 8 weeks? Maybe we start to see hypertrophy or muscle growth and real force changes there. But immediately, no. All right, and the final sign is if you're doing lots of this stuff, bridges, clamshells, leg raises, side leg raises, all the glute stuff, all right? And it's not working. Let's just say you've been doing it for 4 to 6 weeks, thinking, because you've been led to believe, glute weakness is the cause of my pain, so I should strengthen. And well, the PT told me it could take time. It's a very classic thing. It could take time. And so for the past 4 to 6 weeks, 2 months, 3 months, I've been strengthening my glutes, and they say it'll just take time. Well, how much time do you have to kill before you want to move to the next thing, because that's not working?
Yeah.
And so if you've been working at this, you should see strength changes 4 weeks, maybe a little bit sooner with some of the neurological changes, but true strength changes like growth in the glutes, all right? Girthy glutes. That's different. After, say, a 6 to 8 week time frame. But if it's not working, then the chance at continuing down that path and eventually having it one day work and taking more time for it to work, and it's actually going to work, is not very high. All right, so we talked about all the signs, or several signs there, that glute weakness is likely not the cause of your symptoms, so you save a ton of time and energy, money from going down that path. But what about the signs that indicate it may, or suggest, or give evidence to the fact that it actually may be contributing to what you're dealing with? The first sign is going to be if you have a pain in your butt, pain in the piriformis area, during activities which require that area to work and to produce force.
So not sitting.
Right. We talked about the signs that glute weakness is not the cause of your issue. If you have trouble in the absence of motion, in the absence of needing any type of strength or power from the glutes, sitting, lying down, sleeping, things like that. But if you have symptoms during activities such as walking, such as climbing hills, stair climbing, running, jumping, squatting, any of these activities that require that muscle to really stabilize the hip, then that is just one sign that, hey, maybe I don't have the force capacity or the resiliency in that muscle group to handle the stresses placed upon it. So let's just say squats. Maybe they require, I don't know, X amount of force. Let's just say 100 horsepower to accomplish what it needs. But maybe your glutes only have 75. And if you bump it up to 100, then you're able to match the capacity of that activity and you're able to do it now pain-free. Makes sense? So if you have symptoms during an activity which requires your glutes to actually be working and functioning and calls upon them to produce force, running, jumping, things like that, then that's one sign. Second sign is that if your symptoms came on gradually. We talked about how it doesn't make sense if symptoms came on suddenly, that all of a sudden your glutes became weak in 10 seconds. That doesn't happen. And so just as it takes time to build strength, strength declines happen over time. And so if the symptoms came on gradually versus suddenly, then this may be an indication that, yeah, potentially you've let yourself go a little bit, or you haven't continued to remain as strong in that area. And in direct proportion to the drop in strength or function or coordination or whatever of the glute muscle group, your symptoms also came on, then this may make sense and explain why you have pain in the butt.
And does it line up with the story too? Like, does that actually make sense? Meaning, if you're still doing all the same activities, you don't just like lose strength, even though you've kept, like gym is obviously an easy example. Like I've been still going to the gym and doing my same workout during that whole time, even if it came on gradually, well then maybe that doesn't make sense because how would you, versus if it actually lines up with a story like, hey, I actually stopped going to the gym, so I'm probably not working out. Like, does the weakness, like, does overtime weakness actually make sense with your activity change? Or has your activity been the same? And then you don't just like, do you just stop losing, like, do you lose strength even though you're
smart cookie?
You know what I mean?
Yeah. Smart cookie. Yeah. So it's got to make sense with the story is what she's saying.
Yeah.
If you're like, hey, I'm still lifting the same amounts and I'm going to the gym every day, but my pain came on gradually, Charlie, and you said in this video that that means this. No, you didn't.
Yeah.
You didn't reduce the overall stress, strain, and challenge to the glutes. But if you're somebody who says, hey, I stopped exercising, I became more sedentary, I wasn't working out this area as much, I've just become weaker in general over time because my lifestyle's changed, etc. And oh, by the way, my symptoms started to come on, then maybe that's a story match.
Yeah, like a piece of the puzzle that actually makes sense.
Correct. Very good.
Yeah, thank you.
So just, this is awesome because you could take one of these little signs and say, oh, that's me. But if the story doesn't jive and doesn't make sense, then, well, that gets thrown out the window. And then that clue or that piece of evidence gets kicked to the curb. Another sign is if you've experienced increased pain with lengthening or stretching. So if you take point A and point B, stretching is essentially just lengthening any form of tissue. So if you've tried figure 4 stretching, if you've tried nerve glides, hamstring stretches, IT band stretches, rope stretches, all kinds of different stretches, pigeon poses, hip openers, stuff like that. There's a million different ways to do it. And it hasn't worked, well, that's just really a form of lengthening, stretching. So if you've noticed increased pain with lengthening, then that tells us that, well, what's the opposite of lengthening?
Shortening.
Shortening. What's the opposite of trying to become more mobile?
More stiff.
More stiff or more stable.
Yeah.
And so if you apply this rule of opposites, well, if pulling point A and point B further apart doesn't work, well, then what's the opposite of doesn't work?
Maybe it will work.
Does work.
Yeah.
And so what's the opposite of this?
Pull them together.
This.
Yeah.
And what does this?
Contracting muscle, tightening it,
strengthening. Yeah, contracting it. Good job.
What's the right answer?
Yeah, and so when you make a muscle, it bulges up. The elements within the muscle itself come closer together versus if you're lengthening, they pull further apart. And so you could say strengthening is kind of shortening and lengthening is pulling it further apart.
Right.
And if you can lay on your back for a second. Okay. And so an example of lengthening, again, a figure 4 stretch. Go ahead and show me. You can see visually how she does this, and it pulls this. If she had a bodysuit on, it would tug this area. It would be lengthening point A and point B. Versus now she goes to shorten that area and bring it closer together. How could she do that? You do this and do that. And you can see it slackens it. right? It brings this tissue closer together versus if she does a figure 4, pull that across your chest, it lengthens it. So if lengthening isn't working, what's the opposite of not working? Working, what's the opposite of lengthening? Shortening. That suggests if lengthening you have not responded to, that strengthening may be a solution for you, or at least contracting that area. A couple other things along those same lines, if you've been doing different stretches, figure 4 stretches, pigeon poses, all those different things, nerve glides, stuff like that, and those things, while you do them, are yucky, meaning they make you feel worse, and the chance, again, that you're going to do them over and over again and have yourself feel better is not very high. Yeah. So that'll be another sign you've tried lots of stretching and it hasn't worked. Again, the opposite of hasn't worked is something works, and the opposite of pulling 2 points further apart, lengthening, is shortening. And so the fact that you're not responsive to lengthening gives us evidence that you may respond to the opposite, which is shortening or contraction, strengthening, different ways to kind of contract or squeeze that area. Along the lines of this lengthening versus shortening sort of debate and how it maybe relates to your symptoms, and proves or disproves whether or not glute weakness is the cause of your symptoms, is to assess the range of motion and rule out mobility as part of the issue. If we can identify that mobility is not part of the issue, again, the opposite of not part of the issue is part of the issue. We just play this rule of opposites. That's the only logic behind it. And the opposite of mobility is stability. And so go ahead and assess the range of motion. You can do this watching by just getting into a figure 4 position. We know that if the hip is above 90 degrees, externally or outwardly rotating the hip in this fashion tends to lengthen or elongate the tissues in the buttock, the piriformis muscle, for example. And you can see, let's just say this is her painful side. She has X amount of motion. Maybe her leg flops a few inches from the table. Now she does this side. And you can see that they're pretty similar right to left, but she only has pain on the right side. So what does that tell you about the impact of motion on your symptoms?
Yeah, it's not the problem.
Yeah. It's not the problem, because if it were the problem, then you should see a very clear difference between your painful side and your non-painful side one way or the other. But you have the same motion side to side, but you have different pain. You have pain here, but not pain there. And so what this allows us to do is say it's most likely not a motion problem. And if it's not a motion problem, it may be a stability problem. And so that, again, maybe would give us a clue as to the fact of, well, glute weakness or lack of glute stiffness may be part of the issue. And if we strengthen it or contract it repeatedly via some strength training program, then we may get the relief that we're looking for. Another sign is if you find an activity that's painful, maybe stair climbing, squatting, lunging, walking, something like that, jumping, any of those activities, again, very common for folks to feel pain in the butt, and you tweak it or you modify it such that through engaging the glutes more, you actually are able to shut off the pain. And this is a sign that you might respond to a glute engaging program, a program that works the glutes. So for example, let's just say she has trouble going down the steps because that's when she has a pain in the butt. Well, one test we often do to determine sort of the overall coordination and strength or control of the kind of glute hip complex is what we call step down test. You would stand on a stair step, and then you would just lower that heel down. And what we're looking at is we're looking to see what happens with the knee. Now, over the years, I don't put a lot of emphasis on this, but as you can see, her knee is caving in when she does it. It's not good nor bad, but we know that the glutes are meant to sort of control that, so to speak. So the glute muscles help rotate the leg out. So they help what we call externally or outwardly rotate the femur, and they help abduct the hip. So raise the leg out to the side. When the knee falls in, the opposite is happening. So the femur is rotating inwards, the knee is diving in, or what we call the leg is adducting or coming closer to the midline. Again, it's not good nor bad, but it potentially gives us some evidence to say, hey, I wonder if the glutes are maybe not as strong as they need to be or something like that. And so what I can do is I can say, all right, while you're doing activity, again, an activity that produces pain. So while you're doing that, let's just say in her case, she feels pain in her right butt cheek. Now what I'm going to do is I'm going to tweak the movement to see if I can shut off her pain. And in order to get her glutes to sort of work more or her body to coordinate the motion more, just to keep it really general, I'm going to say, hey, I'm going to try to pull your knee in as you're doing that, and don't let me. Perfect. And you can see that when she does it, her knee stayed more, quote unquote, aligned. Again, not good nor bad, But what happened when I did that? Was it same, better, worse, your pain?
Better.
Okay, so this reduced her pain. So pulling her knee in, the opposite of what her glutes are designed to do, which is rotate out and push out, made her glutes function and maintain that position, which reduced her pain, which tells me, if I get those things to turn on more or work more or activate more, and that movement pattern is quote unquote corrected, then it seems to remove her symptoms. And that gives me some evidence to think about how could I give her a specific movement as medicine that could replicate going from here to there. And well, you could do a clamshell, you could do a bridge where you put a band around the knees, you could do squats with bands around the knees, you could do different jumps with bands around the knees, you could do a lunge with, again, something pulling in the knee so that you have to fight to keep it out. And when I put that band around your knee and I pulled out, where did you feel it working most?
Right in my right butt cheek.
Right in your right butt cheek. So if you were to try that at home, you'd feel it really working that area. So just something to consider. So this little movement tweak resolved her pain. She had it. Then when I corrected that movement fault, had her work her glutes more, it reduced or took away the pain. That tells me, we're on to something. Her body seems to prefer that for some reason. How could we take that tweak and inform a specific movement we could use as medicine, maybe a clamshell, maybe a bridge, maybe a leg raise, some type of rotation, and we could test that to find and make sure it's going to work for you. All right, wrapping this up, final sign. If you believe that deep down your glutes are weak for whatever reason, you look in the mirror, one looks smaller than the other, someone else said something, told you something, and has led you to just buy into this, oh my gosh, my glutes are so weak, and therefore, if I strengthen them, I know I have to strengthen them, Charlie, and all my symptoms will go away, then guess what happens? Well, if you believe you can or you believe you can't, either way, you're probably right.
Yeah.
Something like that. All right. So if you have that belief, and that's truly what you believe, then chances are you may actually respond to glute strengthening. And we call that placebo, right? The expectation that this is what I need and this treatment will work, and I know it's what I need and I know it'll work. Even if it doesn't work now, somehow magically it'll work in the future, then you may just respond to a glute strengthening program. All right, so is glute weakness the cause of your piriformis pain? Should you strengthen? Should you not strengthen? Hopefully this video broke some belief systems for you or helped inform what you should do versus maybe what you shouldn't do or might want to consider against. If you're interested in getting some help and you want a systematic scientific way to resolve this problem, so you're not just doing a random sheet of exercises or doing what other people think or feel you should do, but you want to actually find out what's best for you, just click the link below somewhere in the description to apply to work with us. Again, we work with people all around the world dealing with back, butt, sciatica problems. It's my exclusive specialty. I'd be happy to review your case to see if we can help. So click the link below to apply to work with us and let me know your thoughts below in the comments. Thanks.